in terms of sales and marketing, you use the example of how, you know, if you're genuinely patient-centric, it does put more pressure on because you really do want to,
I think the
change
current,
people's lives. But how does that help change sales and marketing?
Well, the current approach in the industry is push, 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 right? It's reach, frequency, frequency, frequency. And you know, in some cases you have to play by this game because the competition forces you into this thing. But the real winning is really ensuring. I can give you an example of a real winning. It starts with the science. The real winning starts with the science, and then the key is just getting the payers, the prescribers, and in the US the patient know that this is available, that, you know, the results of this science. The enabler is what I mentioned, is that I think it unleashes energy when you say, okay, I'm making the difference in people's life. But it's also a huge pressure because as long as there is one individual that suffers greatly in a disease that you target, if you're generally customer-centric, if you generally care about that individual, it's one individual too much. So the pressure on performance is actually big. So I'll give you the example of Vimpat. Vimpat is indicated for refractory epilepsy, a subset of epilepsy called partial onset seizures, refractory to other anti-epileptic drugs. Well, there is 1 out of every 3 epileptic patients that have this type of seizures that is refractory. So if you provide a new medicine that is indicated for that, every patient that wakes up in the morning that still have these seizures is one patient too many. We have to give every individual, now we don't give it directly, we give it through the physician. And so, you know, coming back on the sales and marketing of the future, I don't know if it's the sales and marketing of the future, but that's very much the way that, you know, we're thinking. The best decisions is always, it's always about people. It's always, you know, assembling, because at the end, you know, there is a lot of, the CEO is as good as his team or her team.